Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith Rogers. Today, President Trump's executive order around vaccines. My co-host, Dr. Josh Sharfstein, a pediatrician and former health official, joins me to talk through the order, what was said, and what it means to happen now. Let's listen. Dr. Josh Sharfstein, it's good to see you. Welcome back to Public Health on Call.
Hi, Lindsay. I'm here as always, been called.
Well, we've been calling you a lot lately, and today it's to talk about President Trump's executive order on changing the childhood vaccine schedule. I'm calling you because I know you've been tracking this closely, and I know that in your career, you've worked on vaccination policy at the local, state, and federal levels. So I think, first of all, let's just kind of talk about what exactly happened here.
So the president issued an executive order, and it covered a few different topics. It asserted the vaccine schedule should be what the Department of Health and Human Services had announced back in January before the court stopped them. And then they also had this interesting statement that the MMR vaccine, which is the measles, mumps, rubella vaccine, should be given as 3 different shots over time. So you get the measles and you get the rubella, then you get the mumps vaccines separately, and that it should be the policy of the government to work towards that. It covered a couple other things too. And then they had this event in the Oval Office where different people were speaking to it, but not in a way that really they brought any new information.
And so essentially, this is a doubling down of the previous recommendation to lower the number of vaccines. Now, repeatedly, I have heard the president compare our vaccine schedule to that of Denmark's. That has come up now again. What do we know about Denmark's vaccine schedule?
Well, there was some very misleading information that was put out as part of the press conference on a bunch of different issues. One of them was that the United States is this huge outlier that does so many more shots than other countries, and that's just not true. And I think the U.S. vaccinates against 17 diseases. There are other countries that do that. There are another bunch of countries that do 16 diseases, 15 diseases. Denmark's down at 10. So Denmark is the outlier. Denmark doesn't even routinely vaccinate against chickenpox, despite the very serious consequences and the, well over 1,000 deaths from chickenpox that we've had in this country. The administration wants to keep vaccinating against chickenpox still in the recommended category, despite that not being the case in Denmark. So it's a little bit confusing, but the assertion that we're way out of step with the rest of the world is just false. Then you have this issue of splitting the MMR into 3 vaccines. Can we talk about that for a second?
Yes, I would love to talk about that because in my mind, that means now you're getting more vaccines when they're saying you should be getting less.
Yeah, but let's just pause on this for a second. Denmark doesn't do that. So the whole idea of we're going to go to Denmark. There's no country in Europe that does that. There's no country on planet Earth that does that. Okay, it's not even possible because those vaccines aren't really made in the quantities to be able to do that. There is no scientific authority that has recommended it. There's no study that backs it. So the question, I think, it's where in the world did that come from? It came from a study and an assertion that was made more than 25 years ago, a paper published in The Lancet that was actually retracted because it was scientifically invalid. That's where it comes from. The author of the paper, who had a patent on a competing product that would have been like a single vaccine, got up and said, we should not give the MMR, we should give them as 3 separate shots. That paper was retracted. He lost his license in the UK. And here we are 25 years later. Not a single reputable scientific organization backs it. No country on earth does it. And it is now the policy of the United States to try to make it happen. And to understand why pediatricians and the public health community were so perplexed, frustrated, and outraged by what happened, you really have to understand how there is nothing behind the president's argument in this case.
Well, just one thing I want to pull on here, though, is that once again the assertion that there is some connection between vaccines and autism. And building on that just a little bit more, one of the things they picked out was the addition of aluminum as what we call an adjuvant to the vaccines, and that somehow is something that also needs to be addressed. Those didn't necessarily come out of nowhere, but we also know there's not a lot of evidence for them. But, where do those stand in this conversation?
So the assertion that vaccines may cause autism, as you know, dates back a few decades, in part to this paper that was retracted that I mentioned, in part to some other allegations that were made. And it's been very extensively studied. We have done some podcasts on that question we probably should link to with some experts in this area. Multiple studies, multiple countries, no evidence of a connection. It's so strong that the National Academies of Science, Engineering, and Medicine, like the leading scientific authority in the country, put out a statement saying there was overwhelming scientific consensus. And on that basis, quote, we support the statement that vaccines do not cause autism. So in the public health, medical, scientific community, this is not something that's taken at this point seriously in the absence of evidence. Aluminum is an adjuvant, as you said. It helps the immune system recognize the vaccine, so the body is prepared to fight back when it actually comes in contact with the virus. Aluminum has been studied as an adjuvant and found to be appropriate. And now there's some conflicting studies about whether it might have a role in asthma, but the largest study to date, which was actually conducted in Denmark, has not found an effect. And there is not evidence to support the claim that aluminum in vaccines causes autism.
Where is this conversation going right now?
That's a great question. Let's step back and remind ourselves that this is a discussion of federal recommendations, but it's not a question of legal requirements. Those are the responsibility of states. And also, this is not a question of whether the federal government will try to deny access to vaccines, as the administration, including the president, has said repeatedly that that's not on the table. So this is really about what's recommended. It's part of the national discussion of vaccines. And so it's important to consider who is the audience here. For scientists, for pediatricians, for public health professionals, an executive order where the president is making assertions that have no basis in evidence is not going to be very compelling. But I don't think that was their audience. I think their audience were people more generally and parents more generally. And there was a lot of language about taking care, realizing that, say, the measles vaccine could be lethal. That was one of the statements. That is very scary language for parents. It's very confusing. And I'm worried about that. I think that there are a lot of people who support the president politically, and they may, for that reason, be inclined to give a lot of weight to things the president might say about vaccines. And I don't think vaccines should be political. I think regardless of people's political backgrounds, they should be getting good information about vaccines. And I'm worried about people who may be susceptible to confusion and not really trust their pediatrician who knows better, frankly.
I think there's a sense from a lot of people like, well, who cares, if people don't want to vaccinate their kids. But we're also talking right now in the context of one of the biggest measles outbreaks that we've seen in a long time. Like, there are serious consequences to this.
I think that's right. We have the biggest measles outbreak in decades. We're about to lose our status as a country that's eliminated transmission of measles. That will happen, I think, later this year. And measles is a serious threat. It's a highly infectious virus, and not everyone can be protected against measles directly by the vaccine. So it's not just a question of, I want to protect myself, you don't have to protect yourself. It's that when society is protected, then people who can't protect themselves are protected. And that includes all young babies before they can get vaccinated. And so if we want to have a country where parents aren't terrified to bring their children out for fear of a very serious measles infection, measles can cause many different kinds of complications, including death and even including long-term complications, then we need to take the measles outbreak seriously, and we have to recommend a safe and effective vaccine against measles.
There's one other thing I want to ask you, and I know you're not a legal expert, but part of this executive order was a request to the Attorney General to pursue cases that have to do with medical and religious exemptions to vaccines. What is that about?
Well, states have different policies about who is required to be vaccinated. And all states have a medical exemption. If you're going to get sick from the vaccine, then you don't have to take it. And most states have exemptions for true religious beliefs, although how that is actually implemented varies from state to state. This is an attempt basically to ask the Attorney General to sue the states that don't or to try to create a standard for implementation that's quite broad. And it just is of a piece with the idea that, parents should be able to decide on their own whether they want to be vaccinated, which is ultimately what this administration has said, that every parent should be able to decide on their own. The problem with that being that if there are a number of kids who aren't vaccinated, then the entire population is at risk as the viruses such as measles circulate more, and kids who can't get protected are at risk. And I guess the fundamental question for me is, can a community choose to be measles-free?
When I was preparing for this interview, I saw, how different news outlets are covering this story, what people are saying online. And one of the things that popped out to me was this assertion that, parents are stupid if they listen to this. Parents are stupid if they disbelieve science and only listen to politicians. Where does that come into the conversation? How is that helpful or not helpful?
Sure. Well, I was actually on a television program where one of the hosts said that, and I disagreed. I think that parents want the best for their children. And parents are really interested in good information, but they don't know where to find it. And if they're turning on certain news, if they're in certain chat groups, and they're getting the message that the MMR vaccine is unsafe in the middle of a measles outbreak, it's really stressful. And they may not make the choice to protect their family. Really not because they're stupid at all, but because they're confused. And, I said it's really important for parents to turn to their pediatricians, the people who have been taking care of their children, have their children's best interests at heart, who know the evidence, and that vaccination shouldn't be political. But we live in a time when there's all kinds of signaling about health positions based on politics. And I think this is a great example of why that can be very dangerous. There's very good data that parents trust pediatricians a lot more than politicians about what to do for their kids. And I'm really hoping that that's still the case.
Well, Dr. Josh Sharfstein, we always appreciate your overview on things. And thank you for helping us sort through the news.
Thanks, Lindsay.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.